Okay, because of the limited amount of time we've got here today, I'm just going to dig right in. Welcome to today's program, Transgender Awareness Month, with the VA. We've got representatives from all 5 boroughs with us today. We're very delighted that everybody's taken the time to join to talk a little bit more about specialized services that are available and some of the things that you might not know exist at the VA. I'm Ashton Stewart, and I am the program manager for SAGEVets, which is a New York State program for older LGBTQ plus veterans, 50 years and older. And we get some, I'm located in New York City, and we do primarily work in the city, but of course we're New York State. So we go beyond the borders of our 5 boroughs. We are recording the event today. So if anybody is uncomfortable being part of the video, please keep your cameras turned off. Everybody's microphones are muted just because we have a high number of participants joining us today. But we will have a Q&A session at the end of the program. So please post some questions in the chat and we'll be able to address them that way. Ashton Stewart again, I use he, him, his pronouns. I'm a veteran of the US Navy, first Gulf War combat veteran. And I've been managing this program and joined SAGE since 2018. I'm very proud to be part of SAGE and running this wonderful program and working with fellow veterans. A lot has changed within the US military over the last 10 years or so, especially with policies, and also a lot of changes within the VA to accommodate those changes. This past September, we observed and commemorated the 10-year anniversary of the repeal of Don't Ask, Don't Tell. And earlier this year, the current administration had repealed or ended for a second time the transgender ban. The first time it was ended was 2016, and then was re-implemented again in 2019. And then again in January of this year, it was ended again, which we're really delighted about. And so here to talk a lot about how things are changing in the VA. We've got a wonderful panel, and our first group is going to be addressing some of the things. I'm going to let Chrissy take it from here. Chrissy, Jesse, would you like to take the lead? I'm going to mute my microphone.
Sure. So Dr. Esposito and I and Dr. Halberstam are LGBTQ veteran care coordinators I'm for Manhattan. Dr. Esposito is at Brooklyn VA and Dr. Halberstam is the Bronx VA. And so we are going to kind of kick things off and just talk a little bit about the role of LGBTQ veteran care coordinators, sort of what we do, and then some of the kind of give you a broad overview of some of the services available to transgender and gender diverse and LGBTQ plus veterans. So I'm going to pass it over to Dr. Halberstam to get us started.
All right. Welcome, everybody. I'm glad to see such a nice crowd today. My name is Dr. Batsheva Halberstam, a psychologist. I apologize, I have a little bit of a cold, so it might be hard to hear me. Oh, where'd that go?
The slides are gone. Oh, there we go.
So as was pointed out before, every VA facility is required to have an LGBTQ plus care coordinator. I am the one at the Bronx VA, Jesse is at the Brooklyn VA, and Dr. Ingenito is at the Manhattan VA. We offer a variety of services as LGBTQ plus care coordinators, which I'll get into in a little bit more detail. This is the contact information for all of us, but there's also a web page where you can that has a finder where you can look up any VA facility in the country and find the LGBTQ plus care coordinator for that facility. Okay, next slide, please. Okay, so this program was developed in mid-2016. As I said, every VA hospital has a designated LGBTQ plus veteran care coordinator. And we offer a variety of both clinical and kind of celebratory recognition services. We develop and supervise clinical services for our LGBTQ plus veterans, such as support groups, which we have running in the Bronx VA, a weekly support group for those who identify as LGBTQ plus. We can do evaluations for hormone treatment. And if you're considering surgeries, and provide support letters for those treatments. In addition to providing support letters, if you want to undergo a name change process or various documentation changes like changing your passport, birth certificate, et cetera. So we can offer both evaluations and letters of support for those. We also publicize the community LGBTQ plus resources at the VA. So for example, an organization like SAGEVets will get promoted, and various other LGBTQ plus centers around the city that offer services. Okay, we also publicly commemorate significant days, weeks, or months for the LGBTQ plus community. For example, Transgender Day of Remembrance, Health Awareness Weeks. We participate in Pride Month and do a lot of programming in June, and participate in our both local and citywide Pride parades. The last time we had an in-person Bronx Pride Parade, we did have a booth set up, and that was like 2 years ago. We also try and train staff in LGBTQ plus cultural competence. I have a didactic that I do with all of our psychology interns that does training in cultural competence and really the unique needs of the veteran LGBTQ plus population. We also have our own employee resource groups where just the employees of that hospital will come together, and that's on a volunteer basis, and participate in these activities, offer support, and also disseminate education to the rest of the staff. We support developing a welcoming environment in the hospital, and will remediate if necessary, if people are having an experience that was uncomfortable or not in line with VA policy about how we are obligated to treat all of our veterans, and then we can step in and offer some remediation for that. It's also, there is a patient advocate in every VA hospital for people with LGBTQ plus identities. They might want to, come to one of us first, and we can facilitate a meeting with the patient advocate if that's indicated. We outreach to different LGBTQ plus community organizations, share information about programming. I know that I get Ashton's emails a lot, and we will let each other know about different events that are happening. And again, here is a link for where you can find the LGBTQ plus care coordinator for every VA facility in the country. And this is just a kind of an overview, but if there are any questions, I'm happy to answer them.
I think we will table questions till the end, but thank you so much. Just sort of picking up on that, I'll also just add to that resource about finding of LGBTQ plus VCC has also been helpful for veterans who are moving. A lot of times I'll get contacted by veterans who have recently moved to New York City and kind of want help navigating the system, and that's certainly something that we do in our roles. I just sort of wanted to highlight the VA's official policy on providing healthcare to transgender and intersex veterans. This came out in 2011 and has been revised and renewed a number of times and is currently active. I think the most recent version was 2018. Basically, the policy outlines the services that the VA will provide to transgender and gender diverse and intersex veterans, and also some of their rights. And so I on this slide, we're just kind of highlighting some of the important points. I think it's good for veterans to know that they should be addressed and referred to based on their gender and the pronouns that they use. That goes for restrooms, that goes for room assignments if they have to be admitted to the hospital. There's lots of sort of barriers to making kind of changes as far as the medical record goes when it comes to legal name or birth sex. That can be complicated, but veterans should know that when they're meeting with their provider, the provider's documentation should be consistent with the name, the pronouns, the gender that they use. And among the different services that the VA will provide specific to this population include gender affirming hormone therapy, laser hair removal, a variety of different prosthetics, voice therapy, fertility preservation for folks who may be undergoing gender affirming surgery or hormone therapy and sort of want to preserve fertility prior to doing those things. And a variety of mental health services. And we're actually going to be hearing from some of the folks from these different services who are going to talk more in depth, which is great. Unfortunately, none of these policies have ever included gender affirming surgeries, but we do have some updates on that. Currently, the VA does not provide gender affirming surgeries, and they also don't pay for it in the community. In the again, the policy emphasizes diversity awareness and a zero tolerance for harassment, and the expectation that staff treat information about someone's transition or their gender identity confidential unless given permission. Next slide, please. Okay, so some of the recent sort of more hopeful changes around gender affirming surgery. In June of this year, the VA announced that they're going to be initiating the process to modify the Code of Federal Regulations to expand VA's care to include gender affirming surgery. So this would represent a huge change and is quite exciting, although the rulemaking process takes a while. It takes approximately 2 years. During this time, the VA will have the opportunity to put together a framework to be able to kind of provide this full continuum of care in a way that's consistent with their sort of standards of healthcare. And until the rule is sort of, the final rule is passed in public, the sort of current exclusion stands that VA is not able to provide or pay for these procedures. But this sort of is a positive change on the horizon, and here's to hoping that 2 years is the reasonable expectation for this, and it doesn't get prolonged much further. And as Dr. Halberstam said, I'm happy to answer questions about any of this at the end. So I'm going to pass it over to Dr. Esposito.
Thank you, Chrissy. Okay, you can go to the next slide. So I'm Jessie Esposito. I'm the VCC at Brooklyn. And so I'm just going to be talking about some of the resources available in the VA and community resources as well. I think there was a question in the chat earlier about the slides. I'll be sending a PDF of these slides to Ashton. So, I mean, feel free to write down some of the numbers, but if you do want a copy of it, since there will be some websites, we'll make sure to get that to you if you reach out to Ashton. So first I'll start with some VA resources. So I just wanted to go into detail a little bit more specifically about what is available in mental health. It was mentioned already that we do supply gender affirming surgery support letters. So as Dr. Janita was saying, we don't have gender affirming surgery at the VA just yet, but we do help to supply support letters if you are planning on doing that outside of the VA. Each of the VCCs will work with your medical providers and helping them formulate a letter if they need support around that. So that's something that we can give to you if it's something that you need. We also, which will be talked about more by Dr. Hussein a little bit later, have gender affirming hormone. And so we also do evals for gender affirming hormone therapy that are a part of that process. So it's just something that needs to be checked off. So you'll meet with one of us and you'll do an evaluation for that prior to moving through the process. We also have individual therapy available as well. So most of the time, someone will reach out to one of the VCCs, and then we will assign you to a staff member who we think would be a good fit that will work with you for individual therapy. And then one of the last things we have in mental health across all campuses right now virtually is that we have LGBTQ support groups. I think there's two, is there maybe two on Manhattan's campus and then one at Brooklyn and one at the Bronx. And so again, anyone can reach out to the VCCs and then we'll do a screening for the group and connect you to some support. Oops, I think we just go back one slide. Okay, so I wanted to put the patient advocate information on here. I know Dr. Halberstam mentioned it briefly, and so there is a patient advocate at each of our sites, Manhattan, Brooklyn, and the Bronx. The floor is listed and the direct number to call. It's a great resource, especially if there's something that happened that felt uncomfortable. And this way, it's not just filing some type of complaint or chatting with a patient advocate about certain things and it's not recognized. It really is followed through, it's taken seriously. And so this way we can kind of address any issues that may come up in the VA. One of the other great resources that we work very closely with NYLAG, which is a leading civil legal services organization that combats economic, racial, and social injustice by advocating for people in poverty or in crisis. So we work very closely with them. They're often on site on certain days, but additionally, there is a website and an intake line listed there if you want to be in touch with them. And then another one of our great resources are vet centers. So vet centers were established many years ago by Vietnam era veterans, and they are a way for people to get community services outside of a very large medical center. So it's a community clinic connected to the VA, but also kind of separate from the VA. So we're unable to access any of their records. There's a bit more privacy built in there. They can see our records if they need to, if you have any medical stuff that they would need to attend to. There are certain criteria for vet centers. So if you're interested in being connected to a vet center, if you talk to one of your providers or one of us, we can help guide you in that process and see if you would be a fit for them. Okay, next slide. And these are some of there are, of course, are an abundance of community resources, but these are the community resources that we have the most connection with. The first is Cal and Lord. Cal and Lord's located in Brooklyn, Bronx, and Manhattan, and the website is up there. They provide primary care, sexual health, behavioral health, women's health, transgender health, HIV treatment and prevention, case management, and then other services as well, regardless of ability to pay. So it's a really wonderful resource. Then there's the center, the LGBT Center. The number and website is there. They also have advocacy, health and wellness programs. There's arts, entertainment, and cultural events. Additionally, there's recovery resources and then resources for parenthood and family support. The NYU Military Family Clinic is another great resource. It's for any veteran or anyone related to a veteran, and that can be loosely, not biologically related. It could be a child, it could be a married partner, it can be an unmarried partner, and anyone can go there for free if they have some type of relationship with a veteran. And it doesn't necessarily mean they need to be talking about their relationship with the veteran. They do have evening hours, which I know is helpful for people who work during the day. And the number is listed there as well as the website. And then of course, SAGEVets. These are in alphabetical order. So otherwise it would be at the top as they're hosting and sponsoring this amazing event. As you know, it's SAGEVets is for veterans 50 years or older, LGBTQ+, and supply outreach support groups, case management, legal, and there's the number and website there. And then the last, which is a really wonderful resource, is the Sylvia Rivera Law Project. This organization works to guarantee that all people are free to self-determine gender identity and gender expression, regardless of income or race, and without facing harassment, discrimination, or violence. So again, I will send a PDF so that people have access to the websites and the phone numbers if you're interested in any of these resources, and it has our 3 numbers on it as well. We will suspend questions till the end so we can get through some of the other presentations. But for now, I'm going to pass it along to Dr. Hussein, who's a medical provider in endocrinology, who talk a little bit about the resources available there.
Thank you, Jessie.
I'm just pulling up your slides right now.
Thanks, Ashton.
You're welcome. It's just downloading. Just bear with me 1 sec. Your PowerPoint's taking a while. Again. Okay. Technical difficulties. Again.
It's okay, Ashton. Is it easier if I share my screen?
If you have it ready to go, then yes.
Okay. Oh, I don't have privileges to share my screen.
It's loading right now.
Okay.
Okay, here we go. The screen, share. And
All right, thank you, Ashton.
You're
Hello,
welcome.
good afternoon, everybody. I'm Katsia. I'm one of the endocrinology providers at the Manhattan VA. And today I really want to talk to you guys about the different treatments and services we offer at the VA. The next slide, please. So I want to start off by saying the endocrinology department at the Manhattan VA, and actually all the VAs in the city, are very proud to support transgender and gender non-binary veterans. There's over 134,000 American veterans that are transgender and over 15,000 trans people who are serving in the military today. So I want to say a big thank you. You all are very phenomenal. In 2011, there was a national transgender discrimination survey that unfortunately found that 28% of transgender patients delay their care because of some sort of bad experience or past discrimination. And 19% were actually denied care outright. So we are here looking to change that. Next slide, please. We really want to provide a safe and welcoming environment. We want to be able to meet the healthcare needs of all transgender and gender nonconforming patients. And the way we do that is we really take a patient-centered approach. We make sure that patients set personal goals of what they would like to achieve, and we want to make sure that we're there to support them. We also provide gender affirming hormone therapy, which allows patients to attain secondary sex characteristics that they feel are more aligned with their gender identity. Next slide, please. So again, previous slide. So again, veterans that are eligible for VA care may receive all medically necessary care, but beyond this, we offer gender affirming hormone therapy care, also mental health care, which includes help for substance abuse, tobacco use, and also interpersonal violence. We offer preoperative evaluation, postoperative long-term care, also medically necessary prosthetics such as binders and dilators, and voice coaching as well. Any routine health screening, so this includes prevention of any sexually transmitted infections, cancer screenings, and infertility issues. And also, as just mentioned, the transition-related surgeries are not covered just yet. And as mentioned previously, this past summer, the VA did initiate this rulemaking process to modify the Code of Federal Regulations to expand VA's care to include gender-affirming surgeries. Now, as mentioned previously, this can take up to 2 years. In the meantime, during the process, the VA will continue to provide or pay for the service it currently offers, including, and I don't think a lot of people know this, including corrective procedures after gender affirming surgeries that are done outside of the VA, and also gender affirming hormone therapy. The next slide. This is for who to email for your preferred name and preferred pronoun. I know that can be very distressing for a lot of patients. You could also tell your provider as well. I've done this for several of my patients, as well as I know that Chrissy and Jesse put up a lot of informational resources for you guys, but the main website, patientcare.va.gov/LGBT, has a lot of resources on there, policies, questions, and fact sheets on the website. So that's a good resource as well. Next slide. So I want to discuss with you guys just very briefly the different types of hormone therapy we offer. And it's a lot of information, but it's just our general approach, the different formulations, the side effects, how we monitor. And the reason is just to get, you guys familiar with what sort of things we offer at our endocrinology clinic. So feminizing hormone therapy is the development of female secondary sex characteristics. And so we try to suppress and minimize male secondary characteristics. Usually with this therapy, patients have some breast development, a redistribution of facial and body fat, reduction of muscle mass, reduction of body hair, sexual and gonadal effects that we go over. There's also a reduction in erectile function, some changes in libido and mood that we address. And our general approach is to start with some sort of estrogen and an androgen blocker, and in some cases, progestogen. Next slide. So we offer this in an oral pill formulation, also transdermal patch. We talked to you guys about what you prefer. Anti-androgen therapy is also added, such as spironolactone or finasteride, and the aim is to suppress the amount of testosterone production, leading to minimization of male secondary sexual characteristics. And sometimes when patients don't tolerate estrogen at high levels, we'll add on an anti-androgen to allow for lower doses of estrogen. Oftentimes we'll also use progestogens. The most commonly used synthetic progestin in the context of transgender care is Provera, which we provide. Next slide. And there are some side effects and risks of treatment. So we discussed this thoroughly before treatment, including migraines, mood swings, hot flashes, and weight gain. And we really provide individualized care. And so if a patient is at risk for cardiovascular disease or high cholesterol or blood clots, we'll use a different formulation over another. So we'll use the transdermal route instead of the oral formulations because of the lower rates of clots and cholesterol. And so we make sure that we discuss, in detail the different comorbidities and what patients are at risk for, and we tailor the therapy accordingly. Next slide. And so we get baseline labs, we monitor every 3 months and then 6 months. And the goal really is to provide gender affirming hormone therapy, but with the most, the safest way possible. And we titrate the doses of these medication driven by patient goals in the context of their clinical response, their side effects, their hormone levels. And we do this in a very safe and organized manner. And the time frame depends. Some changes can be seen within a few months. Others take about 2 or 3 years for maximal feminization. It really is patient dependent. Next slide. For masculinizing hormone therapy, the goal is to develop male secondary sex characteristics and suppress or minimize female secondary sex characteristics. So the general effects of this is usually development of facial hair, changes in voice, redistribution of facial and body fat, increased muscle mass, increased body hair, and change in sweat and odor patterns. And then we go over the sexual effects as well, increase in libido, clitoral growth, and cessation of menses. And the medications we use are usually testosterone therapy with transdermal patch, testosterone gel, or intramuscular injections. And we go through each of these formulations, their side effects and how they're used in detail so patients feel very comfortable using them. The intramuscular injections actually can be given at our infusion center. And so we'll set up patients with intramuscular injections if that's what they're interested in, or if they want to learn the first time in our infusion center and then self-administer at home. Next slide. So again, we get labs, we monitor just to make sure everything is done safely. We titrate doses based on patient goals and clinical response and hormone levels and safety labs. Next slide. The risks, again, we go over in clinic in detail, the clots and cardiovascular risks and high cholesterol. And so there have been several studies that suggest that cardiovascular risk is unchanged among transgender men using testosterone compared with cisgender women. And so we just don't have a lot of studies and data. And so we'll use a lot of clinical experience and individualized experience and make sure everything is done according to the patient's profile. Next. So Our goal at the end of the day is to take a patient-driven approach and to find the right treatment plan for each patient. We want to set goals, take a multidisciplinary approach. I think one of the biggest issues is when providers don't speak to each other and are on the same page. And so we make sure we talk to the primary care provider, urology if need be, reproductive endocrinology. We also speak to gynecology and mental health providers, just so everybody is on the same page and we're doing this as a team. Also, this was previously discussed, fertility preservation. So if your VA does not have this, they can put in a community care consult, which is covered to a location that does provide fertility preservation prior to beginning gender affirming therapy. Again, we discuss benefits, risks, and details with each patient and go over the side effects and make sure that everybody is happy with the expectations and outcomes that we have. This is the contact information for the endocrinology and primary care appointment central scheduling. That is the number for the mental health clinic. Next slide. And again, we're always here to support you guys and thank you for your service. Be happy to answer any questions, but I know we're leaving them for the end. So I'll wait for the end to answer.
Thank you so much, Dr. Hussein. That was great. We are going to turn things over to Matthew Vespertino, who is a speech language pathologist at the Manhattan VA. I think he also has slides to be pulled up as well.
Yes. So hi, everyone. My name is Matt. I'm one of the speech language pathologists here at the Manhattan VA. And I wanted to talk to you a little bit today about gender affirming voice treatment. You may find that along the course of your transition journey that your voice doesn't quite align with your gender. And that might lead to instances of you being misgendered on the phone, for example. And so the goal of gender affirming voice treatment is to allow you to explore and find an authentic voice that most aligns with your gender identity. Next slide. I wanted to just say a couple disclaimers before we go forward. This is a very new area of the voice therapy realm in SLP. There is research that is continuing to come out monthly, it seems. So the research is new. And I also wanted to mention that much of the research regarding listener perception of gender in the voice is based on gender stereotypes, things that are typically seen as stereotypically masculine or feminine with regard to speaking pattern and voice. And as we know, there's no one way to be. So I think that that's an important consideration to keep in mind when consuming this literature and also when both providing this therapy and receiving it as well. And the last disclaimer I wanted to make is that of the research that does currently exist, much of it is focused on male to female transgender individuals. Next slide, please. So Dr. Hussein did touch on this before, but I wanted to briefly go over this as well. What sorts of changes can happen to the vocal mechanism with the presence of certain hormones? So when someone experiences a male puberty and there is an increase in testosterone in the body, there are specific changes that happen to the vocal mechanism. Some of these changes include the vocal cords increasing in mass and increasing in length. This will typically lend a deeper or lower pitch to the voice. On the contrary, when someone goes through a typically female puberty, those sorts of voice changes do not occur. And this is an important consideration to make if you are considering undergoing hormone therapy. If you are post-puberty and you've gone through a male puberty, if you begin to take hormones and you are male to female trans individual, your voice will not change. Your pitch of voice will remain steady. On the contrary, if you have gone through a female puberty and you are transitioning from female to male, the increase in levels of testosterone will lead to a decrease in the pitch of the voice, which will lead to a lower sounding voice. Next slide, please. So when thinking about changing the voice to better suit one's gender identity, there are two sort of avenues that you can go down. One avenue is voice surgery or phonosurgery, which is performed by an otolaryngologist and involves surgical alteration to the vocal cords to increase the pitch of the voice. Another avenue is provided by a speech-language pathologist, yours truly, and is voice therapy. And this involves behavioral modification of the voice to achieve a desired outcome. And in this case, that outcome might be to have your voice more accurately portray your gender identity to the world. Next slide. So there are some things to consider when thinking about these two avenues. I think that voice surgery very often is viewed as a sort of quick remedy, and it's really not the case. I forgot to mention in the previous slide, I listed the 3 different ways that voice surgery is currently performed, if you were interested. Those are just listed on the previous slide. So there's cricothyroid approximation, endoscopic shortening of the vocal folds or vocal cords, and laser reduction glottoplasty. So those different methods are all ways that we can either decrease the length of the vocal cords, increase their tension, or decrease their mass, which will all lead to a higher pitch. So next slide, please. With voice surgery, there are a multitude of risks involved. The surgery has certainly come a long way from when it was first being practiced, but there are certainly still risks involved. Some of the risks include pitch instability, decreased ability to get loud, increased vocal fatigue, permanent hoarseness, and just in general dysphonia, voice disorder. And it should also be mentioned that vocal surgery only alters the pitch. And what research has found so far is that regarding, yes, thank you for that resource, Karen, I see in the chat. Regarding the listener perception of gender in voice and speech, there are actually other factors that are equally as important, if not more important than pitch. Some of these include prosody, intonation, breathiness of the voice, as an example. So just to recap, surgery only targets pitch. Voice therapy, on the other hand, targets pitch and all of the other modalities, some of which that I just mentioned as well. And what the research has found so far is that voice therapy can actually have a meaningful impact on pitch, as well as the other suprasegmental features of speech and voice. There are virtually no risks associated with voice therapy. I should also mention that the cost burden of surgery versus therapy. Surgery is obviously quite expensive, and therapy does have a cost associated with it, but it is not quite as expensive as surgery would be. Next slide, please. So just to wrap up, there are 2 sort of avenues that you can go down regarding this sort of area. You can go down the voice surgery avenue or voice therapy avenue. Surgery only targets pitch and has significant risks associated with it at this point. Therapy has little to no risk involved and can have a meaningful impact on the pitch of the voice, as well as other sort of features involved in listener perception of gender identity when speaking. I also wanted to mention that voice therapy is challenging. There's a lot of self-discovery and self-work that is involved, but at the same time, it's also fun and it can be playful. You might find that you discover different sides of yourself that you never knew were there. And I have to say personally, anecdotally, it is fun to work with patients who are seeking this service. I really enjoy helping to bridge the gap between where they would like to be with their voice and where they currently are. So it's personally enjoyable for me as well. And on the next slide, I just included some sources that I consulted and that I consult currently. I didn't include my contact information on my slides, but I'm thinking that I could just type them into the chat box. I can give my clinic number, my email. Feel free to reach out to me if you have any questions. And of course, I will be happy to discuss any questions at the end of this presentation as well.
Okay. Thank you so much, Matthew. So now we're going to shift over to a few more people. We were really lucky to have a representative from each of the 5 boroughs today. So we will just spend a few minutes with each Dr. Bill Christiana, Dr. Elaine Lavin, and Jillian Stein-Sarowski, each representing different facilities. So if each of you wouldn't mind just introducing yourself and giving just some quick information about the setting you work and what's offered there. And maybe we could start with Dr. Christiana. Great.
Hello, everyone. My name is Bill Christiana. I'm a clinical psychologist, and I work at the Staten Island VA Community Clinic. It's on South Avenue. A lot of veterans in Staten Island actually don't even know we exist. So I was hoping today to let you know that and tell you a little bit about the services that we have. We have 2 primary care providers here with the RN. We do blood work. We have podiatry, optometry. We do flu vaccines, and we also provide the COVID-19 vaccine for people. So it's a great place for you to come and get vaccinated, and it's pretty fast to get in. So from the mental health side of things where I work, we offer individual and group therapy here. There's also psychiatry services. And what I find is for a lot of people, being closer, being on the island and coming to us is a little bit easier. Now with telehealth, we can all see people at home, but for those of you who like face-to-face visits, we're open and providers are here every day. I would just like to encourage everybody who's on Staten Island, please come in, come stop by, introduce yourselves. I think the staff here are very welcoming, and I know that the providers here would be more than happy to help anyone who comes in. I'll provide my contact information to everybody in the chat box. If you're interested, you can always reach out to me. I'm here Tuesdays, Wednesdays, and Thursdays, and I'd be more than happy to speak with you about the services that we have, and anything I could do to help you, I'd be more than happy to do that. So,
Thank you so much.
of course.
Dr. Lavin?
Hi, excuse me. I'm Elaine Lavin, and I'm the clinical psychologist at the VA St. Albans campus. And we're sort of somewhere in between the Staten Island Clinic and a full medical center. So we have all the services that Bill mentioned, and a little bit more specialty care. We have some neurology, some pain management, GI, dental, and so on and so forth. Though for more complex medical care, then it does usually result in a referral to either Brooklyn or Manhattan. In terms of mental health care, we have 2 psychiatrists and 5 psychologists serving both outpatients and our community living center. There's a nursing home on site. And we don't have any specialized mental health services for LGBTQ plus veterans. But all of our staff are really dedicated to providing affirming care. And I will certainly do evaluations for my own patients if that's appropriate. You're welcome to come see us in person or virtually for any of your needs.
Great, thank you so much. And Jillian?
Hi, I'm Jillian. I'm one of the counselors at the Queens Vet Center. And so as Dr. Esposito mentioned, the vet centers are specialized programs that offer counseling to veterans who have been deployed in combat zones, survivors of military sexual trauma, which includes harassment, as well as active duty service members who may have served like in the recent COVID-19 mission or some of the natural disasters. And so we primarily offer individual, group, and family counseling, as well as outreach support in navigating resources, the claims process, benefits, all that sort of complicated stuff. And we work in close partnership with the VA, but we were really founded as a community-based space for veterans who may not feel comfortable receiving services in the larger VA system. So we have a small office here in Queens. There are other small offices throughout the city and really throughout the nation. And what I think we offer specifically to folks in the LGBTQ plus community is a smaller setting where we really try to create a space for veterans who have been historically marginalized or feel their voices haven't been heard. And because we're small, we also have a lot of flexibility in creating groups and programs that fit the needs of our client bases. So if you're interested in services, obviously you can talk to your VA provider, but you're also welcome to reach out to us directly. And like I said, the vet centers are national, so wherever you're coming from, hopefully there's a vet center near you.
Thank you. So I think, Ashton, unless there's anything else, I think the remaining time we maybe have for Q&A.
Yes, I think that there was a really first one that stood out. There was one from Daphne and Melody about electrolysis available at the VA. They've been trying to get electrolysis at the VA in LA, Los Angeles, and have struggled with that. Can anybody in the panel address this challenge?
I mean, I want to validate that challenge because we certainly have had struggles sort of in local VAs, and I know some of the VAs in the area don't offer some of these services and they get sent to us. What I would say is that it really shouldn't be on the veteran patient to be trying to establish the community care provider, that there is a department that's supposed to be in charge of that. And I feel like this is an excellent issue to bring to the LGBTQ plus veteran care coordinator. This is the type of thing that, you know, whoever is that person at that facility at the Los Angeles VA can try to kind of advocate for, so that it takes some of the burden off the veterans to sort of try to do the legwork on their own. I mean, I give you credit for all of that. I also think we may have missed one question above that, Ashton. I'm just going to back it up to Michaela. So Michaela is saying that there are 3 VAs in Maryland, but the website that Dr. Halberstam had shared earlier doesn't list any VCCs there. I'm happy to email the sort of program director for the LGBTQ plus VCCs and get an answer for you on that. So I'll put my email in the chat. Michaela, if you want to send me an email, I can follow up with you and try to find you a designated person. I mean, sometimes it is a matter of staff turnover and needing to identify someone new, but if there's 3 VAs and no one's listed, that seems a little bit of an anomaly to me.
Yeah, I took a look at the website and there's not even a Maryland heading. It's not on the list.
Yeah, so I stuck my email down there. You can email me. Sort of moving through. Jesse, you want to take the next one?
Sure. So there was just some questions generally about, I think, what this event is and if this was only for people on the East Coast. So the providers here are located on the East Coast and in the boroughs and mostly New York, but the services regarding VA care and vet centers, et cetera, should be nationwide. Obviously, each VA is a little bit different as we're kind of confronted with this issue with the Maryland VA website issue, but the services should be nationwide. So if there's anything that you're curious about or located elsewhere, as Chrissy offered, in terms of getting connected to Maryland, we can also help connect you to other services in different states and find out who the contact person is. And to the question about the event, this is a Transgender Awareness Month event that we were hosting to celebrate and highlight resources and to help people get connected for those of you who maybe joined later. And then I think there's a question for Matthew about, do you offer voice therapy outside of gender affirming voice therapy?
Yes, I do. Yep.
I've received a question as well that I think just came through from me from somebody who's Hugo Lentz, who's in charge of the Delaware Valley Veterans Consortium, representing a whole different region of the country. And he was asking if there is a document or paper that explains the broad brush strokes of gender affirming treatments, like how gender affirming treatments and surgeries are done, something that could be shared and distributed for some people that are just getting acclimated to these new services that are coming out and rolling out at the VA.
There are actually a number of different guideline resources. Again, we do take a lot of different things into account before starting gender affirming hormone therapy. Like I said, it's very individualized, but a great resource is actually if you go to transcare.ucsf.edu, I'll put that in the chat. It's great guidelines for transgender care, and also other things endocrinologists use is the Endocrine Society guidelines. But we sort of use a combination of the two. And I think the more patient-friendly ones are on the UCSF Transgender Care website. So let me put that in the chat for you guys. And if you guys have any other questions for me, feel free to let me.
I would also add that sort of zooming out from just endocrinology, that the World Professional Association for Transgender Health has a standard of care that you can find on the internet. It's like a full document that kind of covers the recommendations based on this organization across different services and resources, and is often something that I consult with, or we consult with.
There's another excellent question here about eligibility for healthcare at the VA. For those who are not combat veterans, this is an issue. The income threshold, which is $34,171. And if you exceed that, then you are expected to seek your care elsewhere. This question is coming from Portland. So what do you do when you're a veteran and you make more than 34 grand and you're not a combat vet, you have an honorable discharge, and you need specialized services such as what we're talking about today?
Thank you, Ashton. That was a question for me. I was told by the Portland VA and the local Bend field rep, they never question the combat service quotient. I have 2 combat tours, 22 years in service. And I am TRICARE eligible, but it looks like there's some VA services that are that exceed the TRICARE benefits, and I was hoping to get into that program. I do not have a disability. So I'm hearing that maybe I am eligible because of my combat service?
I believe so. There are divisions of veteran services in every state of the country. The one in New York is phenomenal and well-versed in questions such as these and eligibility issues. Will you take my email address, which I'm going to post right now, and I will talk to you offline about trying to connect you to the division in your state.
Excellent, thank you.
You're welcome.
I also want to clarify for the vet center services, which I know may not be the services you're seeking, but they are free regardless of income. So that's always a resource to anybody regardless of income.
Vet centers are phenomenal. I use vet center referrals frequently. The great thing about the vet centers, it's a VA program, but they don't care about your discharge. They don't care about your income. They just care if you serve 1 day or more. And they've got a whole slew of specialized mental health services in particular have really been helpful right now during the pandemic. But I spoke highly of your program when I testified before the city council this morning. So kudos to your program. Thanks, Jillian.
I think Chris had a question.
Yeah, it looks, Chris, however you just wrote that is how you can ask a question, or you can unmute yourself if you'd like.
Okay, there we go. So it's a kind of a two-parter thing I got going on here. I'm currently going into getting bottom surgery, and the requirements for that, I know the VA doesn't cover it, but the requirements for that are 2 letters from a mental health provider. The VA, my counselor at the VA said the VA is not going to cover a second person. And I said, well, thankfully I do have a first person. You're my second person. And so I'm working through community care with my one of my mental health providers to get me a letter. So somebody in the VA, I'm going to make note of that and say, how can we deal with a person coming in for gender affirmation surgery needing 2 letters because of the surgeons need these 2 letters? That's something that needs to be looked at. The second part is that they're trying to figure out is after the surgery is said and done, what part does the VA play in VA in aftercare after surgery?
So I can address the first part of that. At our VA, obviously that comes up a lot, this need for 2 letters, and there's usually a way that we can work it out. A lot of times somebody has met with someone for an intake or like an initial assessment, and that person will sign off on the letter, as well as the person who's treating the person. It's definitely not something that we would say we won't pay for you to have that, that we would work with you to try to identify a second person, even if that means meeting with that person once or twice, so that they can sort of sign off on the letter. And the second part of the question, I'll let Dr. Esposito jump in too if she'd like, but that according to the policy that they are responsible for post-operative care.
Okay.
But it gets a little bit tricky because it's like they won't necessarily pay for like a hotel or for you to stay at the hospital after surgery and have someone take care of you there. It's more like if there are issues that arise around infection or a need for a revision, that's sort of where they come in, as far as I understand it. Okay,
so all right, because I do have what's allowing me to do the surgery is private insurance. So thankfully for that. It's just that nobody, and this is actually the first time the VA in my area in Oregon, in Douglas County, has had to deal with something like this. And so they're kind of asking those same questions of, one is how do we do 2 letters? And then, apparently their response was, yeah, we can't do that. Or they don't know how. Cause I suggested to my counselor, just get me another counselor from the VA, have me talk to them. And as you said, meet with them once or twice. And then they go, okay, here's your letter. Here's your second letter. And then life is good. And then of course, and then you're saying as far as any kind of surgery, any aftercare, the VA will cover that, correct?
Yeah. And I think, that policy that I mentioned, the VHA policy on providing healthcare to transgender and intersex veterans, is available on the internet. So veterans have access to that as well. And, anytime I meet with someone for the first time, I sort of will give them it so that if they run into these kind of issues where providers, I think that every VA is different, and some, the information doesn't get disseminated and providers are not always in the know. And so, that's part of our role, is to kind of change that and serve as an advocate and a resource for you. But it can be a frustrating process to feel like you're one step ahead of the people that you're working with as far as what you're entitled to.
Okay. Now, as far as this meeting goes, and I believe it's being recorded.
Yes.
Okay, so will we be able to get a link to that recording so that way I can kind of chunk this out and then get it to my folks here, and then they can go, oh, okay, now we know the answer.
You bet. We're going to send out a link to this, and we're also going to share slides and the resources that our presenters shared earlier.
Okay, perfect. I think that pretty much answers my questions for right now. So I appreciate the responses. It's just been somewhat of a frustrating event for me because I'm waiting for my community care provider to get me that second letter, and it's being the holidays, so it's like that's going to potentially drag on forever. And so it's like, give me my letter, please. I'd like to get going. All right. Well, thank you, everybody.
Good luck with everything, Chris.
All right. Take care.
Well, this has been awesome, everybody. Thank you so much to all our panelists. Thank you to the VA for being so inclusive and working so hard to get more equitable in your service towards transgender and gender diverse veterans. I've got chill bumps right now because it just feels like we're going in the right direction with this. And I just really appreciate all the great questions we had today. I want to leave you with one thing. This was our first national program because thanks to the VA, they shared this on their website for upcoming events. And they also shared a second event that we're doing tomorrow with the New York State Division of Veteran Services in 4 states that have restoration of honor legislation, which helps anybody with a discharge from the military that's OTH. And the state that they live in that has this legislation will recognize them as an honorably serving veteran. That gives them access to state veteran benefits. And we're going to talk to representatives from all 5 states to see how it's working, how it came about, and how other states can get involved. I'm going to post a link here real quick, but I just want to thank everybody and thank you to our panelists again. Thank you for being here, everybody. I'm going to post this, and it's a CLE. So it's sponsored by the New York State Board of Association. So there's a couple of steps in registering. You got to first set up an account, and then you got to click events and click for the event that's actually tomorrow, 6 p.m. Don't be late. And thank you so much. Enjoy your lunch, everybody. Take care.